Hi, I'm Dr. Corey Goot from DePorre Veterinary Hospital, and I'm here today with the help of our practice manager, Sue, and we are going to go through some questions regarding spaying and neutering your dog.
All right, Dr. Bory, how are dog spay surgeries performed?
So a dog spay is an ovariohysterectomy, meaning that we remove the ovaries and the uterus. So an incision is made on the midline of the abdomen, and once we're inside the abdomen, we locate the ovaries and the uterus. Dogs have a right and a left side. They have what are called horns, and they meet at the cervix. So everything above the cervix is removed, which is both ovaries and the uterus. And then obviously there's a good 3-layer closure to close up the abdomen once the spay has been performed.
And then how are dog neuter surgeries performed?
So dog neuters are a little bit easier. Dog neuters are not inside the abdomen unless you have a dog that has a retained testicle, which is called cryptorchid. Otherwise, it's a pre-scrotal incision, and it's a small incision made that both testicles are removed from, and they're double ligated, and then the incision is closed.
Will the spay or neuter be painful for my dog?
So that's a great question, and we go to great lengths to make sure that all of our surgeries are pain-free. We use the local blocks, so lidocaine and bupivacaine, which are local analgesics or local pain medication, as well as preoperative pain medication, intraoperative pain medication, postoperative medication, and then obviously some good medication to go home as well. So our patients are extremely comfortable, and it's usually all our pet parents can do to keep them quiet because they do feel so good.
And are there any complications to a spay or neuter surgery?
So great question. There's always a possibility of complications during any surgical procedure, but surgery complications are usually very, very low. A surgical complication, the most common one that we would see would be actually during the recovery period. If our owners don't put that cone on when these animals are unattended, unfortunately, a lot of the dogs will lick their incisions to try to calm and ease their healing process. A lot of times they're itchy. And when that happens, they can introduce infection or in some cases even open up an incision. So very rare, but it does happen, and that would be the most complication that we see.
How long does a dog spay or neuter take?
So dog spays typically take around 20 minutes on average, depending on the size. Smaller dogs take a little bit less time, bigger dogs take a little bit more time, and a dog neuter typically on average is about 8 to 10 minutes. It's a pretty fast surgery because we don't go inside the abdomen for dog neuters.
And what are some misconceptions about the spay and neuter process?
So I would say common misconceptions would be a lot of our clients don't feel that it's a major surgery. And you have to remember that it is a major surgery. For females, we are removing body parts, and we are with males too. So making sure that they are calm and resting during the recovery is very important. And then we do have some clients that don't believe in spaying and neutering for whatever reason, but there are a lot of health benefits to spaying or neutering your pet. So today, I hope we answered some of the questions that you may have regarding spaying and neutering your pet. At DePorre Veterinary Hospital, we're always happy to chat with you and discuss any other questions that you may have.